Welcome to the Deep Dive. We're here to break down complex research into the knowledge you can actually use. Today, we're looking inside the healthcare system at something that's often invisible but can have, well, devastating consequences. We're talking about when doctors and patients don't speak the same language discordance, and the stakes are incredibly high when clear communication is literally vital for health.
Yeah, this topic is incredibly relevant right now. Just think about the global picture. Our source material points out something pretty striking. About 3.4% of the world's population, that's roughly 258 million people, have migrated in just the last decade.
Wow, 258 million.
Exactly. And these individuals are navigating, entirely new legal systems, economic challenges, and really importantly for our discussion, new healthcare systems.
Yeah.
And that's often where they hit a major wall, language barriers.
It really adds another layer of difficulty, doesn't it? And unlike missing your bus stop, a misunderstanding here could have really serious health impacts, life or death, potentially. So let's outline what we're doing in this deep dive.
And also, worryingly, increased odds of dying while in the hospital, according to studies like one by John Baptiste et al. Delays in understanding or communicating critical information could certainly contribute there. There was a significant positive association with patients actually receiving lifestyle counseling advice on diet and exercise.
So they were more likely to get that preventative advice.
Much more likely. One study, Emerond et al., found that patients facing a language barrier only got exercise counseling about 43% of the time. But for patients who shared the doctor's language, that number was 62%.
Wow, 43 versus 62%. That's a huge gap. It suggests those important preventative conversations are just not happening or getting cut short when there's a language barrier.
This is likely. And we saw a similar pattern emerge in mental health care follow-up. There was a study involving Portuguese-speaking patients. Having a language concordant provider led to significantly higher rates of what the study defined as adequate psychiatric care. They defined that as having 8 or more psychotherapy visits.
Okay, so consistent engagement with therapy.
Right. And the shared language group hit that mark 58.5% of the time. But the group with the language barrier, only 30.4%, a really dramatic drop-off.
Mm-hmm.
It suggests that building that consistent therapeutic relationship is much harder without a shared language.
Okay, so far, the pattern seems mostly consistent. Shared language equals better communication, equals better outcomes or more complete care. But now, we get to the really fascinating part, the bit that kind of flips the script: cancer screening. This result was surprising, wasn't it?
Oh, absolutely. This was the real head-scratcher in the review, particularly concerning colorectal cancer screening. 2 out of the 3 studies that looked at this, and both of these focused specifically on Spanish-speaking patients, found that language concordance was actually associated with lower rates of screening.
Hold on. Lower rates? You mean when the doctor and patient spoke the same language, fewer patients got screened for colorectal cancer?
That's what the data showed. It's completely counterintuitive, isn't it?
Yep.
We'd expect better communication to lead to more screening uptake.
Exactly. Do they have numbers on that?
Yeah, Iamran and Tolano. That same study reported a screening rate of 72% for the patients who faced a language barrier, but only 47% for the patients who shared the language with their physician.
72% versus 47%. That's staggering. How on earth did the researchers explain that? It seems backwards.
Well, the proposed explanation is really quite insightful and maybe a bit sobering. They hypothesized that the shared language might allow for a much better, more detailed, more nuanced understanding of what the screening procedure, like a colonoscopy, actually involves. Its invasive nature, potential discomforts, risks, the follow-up needed.
So you're saying the patients in the language concordant group might have been making a more truly informed decision.
Exactly. Exercising informed consent to actually refuse the screening because they fully understood it.
Whereas the group with the language barrier might have consented without fully grasping the details, leading to essentially artificially higher screening rates because of poor communication.
That's the leading theory. It really makes you question what we define as a successful outcome. Is it just compliance, or is it genuinely informed choice?
That definitely reframes the issue, but you said it wasn't universal.
Correct. To add another layer of complexity, there was a counterexample. A study looking at Korean-American patients found the opposite the result we'd normally expect. Language concordance led to increased uptake of cancer screening in that group.
Okay, so for Spanish-speaking patients in those 2 studies, concordance meant lower screening. But for Korean-American patients in another study, it meant higher screening.
Precisely, which strongly suggests that it's not just about language. There are clearly other factors at play: ethnicity, cultural beliefs about screening, trust in the medical system, maybe different approaches by physicians. It's complex.
Wow. Okay, so this review covers a huge number of patients, looks at really critical health conditions, and reveals some pretty complex, even paradoxical findings. What are the main takeaways then for you, the listener, especially considering the limitations of this research base?
Yeah, the limitations are really important to underscore here. First, there's a huge geographic bias. 12 of the 15 studies included were done in the United States, and significantly, none were conducted in Europe.
Which is a major gap, right, considering migration patterns there.
A massive gap. Europe is dealing with large influxes of migrants, including from places like Syria, Afghanistan, Iraq. These are populations desperately needing effective healthcare communication, often in languages other than English or Spanish. Yet, our best evidence synthesis is heavily skewed towards the U.S. context and often just looks at English-Spanish pairings. That's a significant linguistic bias, too.
So the findings might not directly translate to, say, a Syrian refugee seeking care in Germany.
We can't assume they do. And related to that point about culture we just discussed with cancer screening, how does the review address the difference between just sharing a language versus sharing an ethnic or cultural background?
Right, because the Korean American example suggests they aren't the same thing.
Exactly.
Oh.
And the review does touch on this. It suggests that in some situations, ethnic concordance might actually be more beneficial than just language concordance. They mentioned postpartum contraceptive counseling as one example, where sharing ethnicity seemed particularly important. It really reinforces that effective communication in healthcare, it might even save money in the long run. We know that shared language is foundational for building trust and delivering truly patient-centered care. And this leads us to, I think, a really provocative final thought for you to consider. If we accept that doctors need to spend more time and effort ensuring understanding when there is a language barrier, maybe explaining diagnoses more slowly, using visual aids, checking comprehension repeatedly, then the big question for future research and policy becomes, how effective are targeted healthcare literacy interventions? Could programs specifically designed to help minority and migrant populations understand complex medical information? Could these programs be a powerful tool on their own? Or perhaps used in combination with trying to find a language-matched doctor? Basically, can we effectively bridge the communication gap, even when we can't always address the language gap? What's the real impact of focusing on health literacy itself?
That's a critical question. Can we empower patients to navigate the system better, regardless of the language spoken in the room? A vital area for future work. Thank you for walking us through all that complex research.
It was my pleasure. Really important stuff.
We'll see you next time on The Deep Dive.